rectus sheath? Arcuate line? Fear not, we're doing layers of the abdominal wall today. I'm going to start with the muscles first, and then we'll layer the fascia and skin on top of that. So, starting off super easy, we've got the six-pack muscles in the middle, and we've got this other stuff on the sides. The six-pack's real name, of course, is the rectus abdominis muscle. Rectus just means straight in Latin, and that's because the fibers run straight up and down. As you can see, it runs all the way from the costal margins down to the pubis, and it's made of several sections of muscle that are separated by these white bands of connective tissue called the tendinous intersections. When you contract it, that's obviously how you do a sit-up. Moving on to these muscles on the sides, there's actually three layers there. There's the external obliques on the outside, the internal obliques underneath them, and then the transversus abdominis underneath that. Now, if we zoom in and have a look at these muscles closely, you'll notice that their fibers actually go in different directions. The fibers of the external oblique come downwards and inwards, like this sort of hands into pocket motion. The internal obliques run 90 degrees to that, and finally the transversus abdominis' fibers run straight across horizontally. It's in the name. Transversus means across. Now I'm going to talk for a bit about what the word aponeurosis means. Take almost any muscle in the human body, the biceps for example. You know that the muscle fibers themselves, the red part, doesn't insert directly into bone. Instead, it all thins down into this strong rope-like cord of connective tissue, which is called its tendon, and the tendons insert into bone. But not every muscle does that. There are some muscles, usually flat sheet-like muscles, which instead of thinning out into a cord of connective tissue, i.e. a tendon, they flatten out into a sheet of connective tissue called an aponeurosis. And those three muscles on the sides all do that. This diagram shows the internal obliques highlighted in green. The white part is its aponeurosis. And the border between the aponeurosis and the muscle itself is called the semilunar line because it has a half moon shape. Okay, now I want you to imagine you take a horizontal or axial cross-section through a person. This is what those muscles would look like. You've got the left and right rectus abdominis in the middle, and you've got the three layered muscles on the sides, the external obliques, internal obliques, and transversus abdominis going from out to in. Now, pay attention to this bit. The aponeurosis of the external obliques comes in front of the rectus abdominis, forming an anterior rectus sheath. Similarly, the aponeurosis of the innermost muscle, the transversus abdominis, goes behind the rectus muscles, forming a posterior rectus sheath. And as for the internal obliques aponeurosis in the middle there, do you want to take a guess? It splits. It splits and contributes to both the anterior and posterior rectus sheaths. So that's what this whole rectus sheath thing is talking about. They're just coverings in front and behind the rectus abdominis formed by the aponeuroses of the muscles on the side. Now, everything I've told you so far is true for most of the abdomen. There is a point about halfway between the umbilicus and the pubic symphysis called the arcuate line. Below this line, things work a little differently. The aponeuroses of all three muscles on the side go in front of the rectus. There is no posterior rectus sheath below the arcuate line. Another way to think about it is that at the arcuate line, the rectus abdominis, which was sandwiched between these aponeuroses, dives behind the last one. This diagram has the external and internal obliques removed. You can see the transversus abdominis there, and you can see how the rectus abdominis dives behind its aponeurosis below the arcuate line. And this is a view from the inside of the abdominal cavity looking forwards. You can see how the rectus dives behind the aponeurosis of the transversus abdominis, and that there is no posterior rectus sheath below that arcuate line. Alright, that's muscles all done, so now let's layer on the fascia and the skin. The way I like to think about it is this. Imagine you had to design a person from scratch. You know that muscles have to slide around as they expand and contract, so you'd want to coat that muscle with a thin, film-like membranous layer first, so that it can slide around smoothly against it. And then you'd pad it out with a fatty layer for cushioning, and finally top it off with an epithelialized layer to keep it all waterproof and contained. With that in mind, the next layer up is a membranous layer called Scarpa's fascia. Above that, you have a fatty layer called Camper's fascia, and finally skin. The way I remember it is going from outside to in, it's in alphabetical order. Camper's, then Scarpa's. That's the order you'd encounter them in if you're doing surgery or dissection. Meanwhile, on the opposite side of the muscles, it's the same pattern. You've got a membranous layer first called the transversalis fascia. It's named after the transversus abdominis muscle that it sits under. Then you have a fatty layer, the preperitoneal fat. And finally, the epithelialized layer is the parietal peritoneum itself. And that's it. That brings us to the end of layers of the abdominal wall. I hope that way of thinking about it was helpful. Now, when you're on your surgical rotations in 4th and 5th year, if a surgeon asks you to recite the layers, you should first always clarify where. If they point to the sides here, then you can pause the video if you want to try it yourself. The skin, then the 2 fascias in alphabetical order, fatty campus fascia and membranous Scarpa's fascia, then the 3 muscles, external oblique, internal oblique, transversus abdominis, followed by the membranous transversalis fascia, the preperitoneal fat, and the parietal peritoneum. If they point here, it's skin, campus, Scarpa's, then anterior rectus sheath, rectus abdominis, posterior rectus sheath, followed by the transversalis fascia, preperitoneal fat, and parietal peritoneum. If they point in the midline, then there's no muscle at all. It's just the skin and fascia, followed by the linea alba, and then the fascia and peritoneum. If they point below the arcuate line, you know there's no posterior rectus sheath there, so it goes straight from rectus abdominis to the transversalis fascia. The final thing to learn for this video is the blood supply of the abdominal wall. It's very straightforward. You've got the superior epigastrix coming down from above and the inferior epigastrix coming up from below, and they form an anastomosis in the middle. These arteries travel in the plane beneath the rectus abdominis within the posterior rectus sheath. The inferior epigastric branches from the external iliac artery, the one that goes down the leg, and the superior epigastric is the continuation of the internal thoracic artery, which itself comes off the subclavian, the artery that eventually goes down the arm.